Good afternoon, everybody. Welcome to another Thursday HiPAM Community Work Group meeting. Good to see you, Jim, Yosh, Lee, and Tammy. I'll wait one more minute and see if anybody else pops in, and then we'll get going for this week's update. Should be pretty short today. Maybe some robust, questions since it's a smaller group. But we'll wait and see. But good to see you guys as always. Aloha, Janet. Good afternoon. Thanks for joining us. So we'll get this going. I know everybody's time is precious. Moving into the end of April and beginning of May and our summer season. So looking at Japan, unfortunately they're experiencing another surge, and we're continuing to keep an eye on, but as vaccination efforts increase and our safe travel program continues to stay in place, we hope that we're trying to, the goal is to mitigate any increased spread from Japan into our islands as much as possible, but definitely a point of concern. And two slides I just added, just now, because I feel like it's good for reference, and we'll refine it moving forward. But I wanted to South Korea, a country that was heralded for its response, for the most part, to COVID, is at a level of infection that is equal to the initial peak. So I think that's important to note, that while we may feel optimistic, and we should feel optimistic about our vaccination efforts nationally, locally, globally, the situation is still one where we have to keep an eye on, especially with our partners, Korea, Japan, and as we look at the rest of the world and see how they're doing, and I'll speak more about herd immunity later on this afternoon. And then if you're not aware, India is definitely, there's a really good article, I think it's New York Times, or I think you just need to search for it. It was this morning, that does a really good job summarizing what went wrong. India had a really good handle. They didn't have an exponential rise in that first in their first wave, but now they are leading the world. If you look at their 7-day average, it is the highest amongst any country ever for COVID, over 265,000 7-day cases for their 7-day average. So definitely some warning signs, some lessons learned that we can take locally. Really, what the after action report for India is they opened back up. They believe they will never hit a second wave. Weddings, gatherings, very limited masks, and now the situation is so dire that they have to have guarded convoys for their oxygen distribution. So once again, just to keep things in perspective, I added that in. For a national level, once again, I think we're trending up and down, but we're holding pretty steady in terms of our 7-day average, a little around 60,000 cases. And once again, I want to reiterate that that's still a level of infection that we're not quite comfortable with, even as vaccination efforts increase. And I'll speak to that. There is some pause or concerns even with our vaccination efforts, and there's some data to support that. Arizona, California, however, continue to be relatively flat, which is great news. And Nevada and Texas, no major concerns. So, for the states that impact us the most in terms of tourism and returning residents who travel to these states, relatively low risk. For Hawaii specific data, Maui continues to trend down. The other counties are doing relatively well. Once again, where we're hovering between 70 and 100 cases a day for the most part. So our level of infection I think, is settling down there, and I don't foresee it to drop too much lower even as vaccination efforts continue. In terms of our vaccine efforts locally, we are doing quite well. However, what's not being captured here is a daily rate of vaccines administered, with a historical trend, and that's something we're hoping to put out once we can get some more validity on those numbers. But from what we're hearing anecdotally, the rate of daily vaccinations um, is not exponentially increasing, or is not steadily increasing at the rate that we are expecting, and that's tying into a UHERO report that I'll highlight in a little bit. Testing turnaround time is no issues here, and our HiPAM 14-day forecast, excuse me, no major concerns with what we're seeing. Things are staying relatively stable. Excuse me. Burden to our hospitals, no issues there. Tourism rates are staying relatively constant week to week, and no major spikes. So our forecast is reflecting that. So three major science highlights. Obviously, there's a lot, and I can speak to some others that came up the past, day or two that may not have that are not included. So three that I'm highlighting for sure: USC significant drop in vaccinations over the past week. Obviously locally, big news. Hawaii plans vaccine passports for inter-island travel first to test the validity, and then potential rollout for trans-Pacific. And then UHERO report from our colleagues at UHERO, where they're estimating herd immunity by July. Some additional call outs to some more science data. There's a new report that came out today adding more support of vaccine safety for pregnant females. So once again, more positive news for those on the vaccine hesitant front, and more education, ammunition to really encourage those who are on the fence to get vaccinated. I found this to be pretty sobering. Some of our core HiPAM members brought this out earlier this week, where we saw nationally 11% decline across the board in terms of our rate of vaccination. And that's important, and it's not just due to the news of the Johnson & Johnson pause. The majority of the vaccines administered in the United States are still due to Moderna and Pfizer, and of course the pause is going to impact some of the rollout. But we are seeing some surveys that are conducting nationally that people are actually appreciative of the information and the education behind the pause of the Johnson & Johnson. But we are looking at this because some of our estimations of potential herd immunity and dulling the impact of the variants is really tied to our vaccine efforts, and we're seeing that in some counties where there is supply, just the demand is not there. So this is something that we will continue to keep an eye on nationally, and we'll speak to this a little more locally in a little bit. And obviously, what that's going to look like when we have to rule out the boosters for the Pfizer, Moderna, and potentially Johnson & Johnson vaccines, and whatever timeline will for herd immunity will be impacted. Hawaii has actually, so this chart from the Washington Post kind of divides up percentages of adults completely vaccinated versus trends in vaccine doses. Hawaii actually has done tremendously well in most recent weeks, so we're actually outside the scale, which is why you don't see Hawaii, which is really great. Which lends to this next science highlight, where state officials have detailed some what it would look like for vaccinated individuals to travel inter-island. And I didn't want to put too much, but basically, you know, we're really working with private vendors, using the Hawaii Safe Travels portal, and travelers must still carry their vaccination card, and they have to replace it if they lose it. Um, the lieutenant governor is quoted in saying that if we reach a point of herd immunity, the vaccine exemption may no longer be necessary. You know, there's still no real point in time in terms of when we expect that to happen, at least as a country. And that our last science highlight will kind of leave as an open-ended discussion for the group. Finally, Yuhiro earlier this week took a stab at, you know, looking at current vaccination rates for the state, and using some 2019 census data and some assumptions when we would hit potential herd immunity based on a 70 to 85% estimation of the population having immunity, and when that would be. And they identified somewhere in July of this year where we would hit 75% of the population currently vaccinated. You know, we're lucky to have some UHERO members participate in HiPAM and as HiPAM members. And this is by no means calling them out. This is just, you know, we're here as a team to continue to educate and to address these issues. And they have identified some limitations in their report. You know, they're stating, assuming vaccination rates stay the same, the willingness of the population to get vaccinated remains unchanged. And they did identify that there is a chunk of Hawaii's demographic, the younger demographic, that is not yet vaccinated, which may impact future spread. And also a final limitation is some massive data dumps by the state, which kind of impacts their weekly estimation. So they actually paused their estimation for this week based on a huge data dump. Some other things that I wanted to call out that we've discussed within HiPAM and from an epi standpoint, you know, variants play a huge role in this, as does human behavior. What we're seeing is, you know, for those who are vaccinated, they may feel liberated and not wear a mask, and what that may do is have a snowball effect, and other people will subscribe to that even if they're not vaccinated. They may think, well, enough of the population's vaccinated where, you know, I'm protected. Even though I'm not vaccinated, I don't have to participate in these mitigation efforts, and we can potentially see an increase in cases due just to human behavior. We still have yet to figure out the true duration of both natural and vaccine acquired immunity. I just wanted to show about a week ago, the Pfizer CEO it stated that there's very likely that we'll need a booster third dose for Pfizer, and of course probably Moderna, a second dose for Johnson & Johnson within 6 months to a year of that's becoming fully vaccinated. And that's important for the logistics and for how we look forward to the future vaccine rollout. And the last 2 bullet points kind of are all related, where right now we're seeing a huge effort nationally, locally, internationally on this for COVID vaccination efforts. However, as we're seeing locally, you know, eventually the Tier 2 mass vaccination sites will slowly dissipate, and majority of the COVID-19 vaccines will be administered at pharmacies, or when people go to their PCPs or the providers for annual checkups. And we tend to know that compliance just to go to their PCP for annual exam or for a vaccine is much lower. And so we can't expect to have the same current rate of vaccinations for boosters, which are going to be very important for the next year or 2 years to keep cases down. So that's gonna impact, quote unquote, herd immunity moving forward, especially with the current variants and potential new variants in the future. Hawaii, while we could theoretically reach local herd immunity, We all on this meeting understand tourism is such a large part of our economy, and we need to continue to see levels of 20,000 new travelers a day coming in, and that's really going to muddy the percentage of the population that quote unquote that has herd immunity in our state. And finally, the last bullet point, and this is just, these are all large scale, high level epi concerns. I don't have any models to back this up yet, but definitely something we're looking at as a group is, our local herd immunity is impacted by the national and the global situation, which is why, we continue to show Japan, and I just wanted to highlight Korea and India, because, we we will, as countries continue to open up with vaccine passports, etc. Not every country has an equal distribution of vaccinated individuals, and the speed with which they're rolling out their vaccines differs. So while Hawaii and while the United States is doing relatively well in their vaccine rollouts, a lot of the rest of the world is lagging. And as we continue to open up, that may impact what we perceive to be herd immunity, both locally and nationally. So I know UHERO just wants to take a stab, and they recognize there's a lot of limitations to their estimation, but I just want to add on some other more epi factors that could impact this potential estimate, and also just other factors that impact herd immunity. So those are just the science highlights I have for the group today. More than welcome to take any Q&As, or we can discuss further. So thanks, Jim, for always having some great questions. So Jim's question: given the potential risk posed by variants, has there been more focus on increasing resources for genomic surveillance? I know nationally there's been an increase, locally as well. We're seeing more collaboration with the state, between the state and some of our academic and private partners. It's just going to take time. It's not just the reagents; it's also the data flow, the data communication, because there is potentially some PII involved. There's some safeguards that have to go and be created. So it's going to take time. I know there is a strong push at a national level. President Biden's pandemic plan does highlight increased surveillance, and that does include genomic surveillance as well, Jim. Okay. Not seeing any any additional questions or comments from the group. Good to see you, Brian and Debashish and Francis. Thanks for joining. I know it's been hectic for everybody, but good to see your familiar names, and glad to see you participate and hop on for a little bit. So I guess we'll wait and see as May comes along, and the safe travels with the vaccine passport for Inter Island takes off. We'll see what that looks like, how responsive and what kinks there are. Hopefully there aren't many kinks, but hopefully that's a step in the right direction. And we'll continue to keep an eye on vaccination rates locally and nationally. Question from Francis: is there data on educating the impact and frequency of long COVID on the willingness for vaccine dollars attitude? That's a great question, Francis. Unfortunately, personally, I haven't had much time recently to look at even long COVID, and that's something I definitely need to read up on, and then further looking at how increased information on long COVID is impacting vaccine doubters. I know a lot of vaccine hesitant individuals, point to some of the short term statistics and the age um, distribution, where it's more the elderly that's affected, though that's starting to become false. We're seeing with this, with the second and third waves, more of the younger population, but we are seeing more and more data on long-term COVID, and I think that is something that should be continued to increase in our education efforts. I haven't seen anything, but I'll definitely keep an eye out this week, and maybe hopefully we'll have something for the Science Up highlight next week, Francis. But thanks for bringing that up, and I'll make note of that. Okay, everybody. Thank you for joining us for another Thursday. I really appreciate your continued presence. It means a lot, and hopefully, whatever you take here is useful, and you can share with your friends and colleagues in your respective circles. But with that, have a great and safe weekend, and we'll see you next week Thursday. Thank you, everybody.